welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. UBAP1L gene may be linked with retinal dystrophy. JAMA Ophthalmology study. Scientists at the National Institute of Health and their colleagues have identified a gene responsible for some inherited retinal diseases, which are a group of disorders that damage the eye's light-sensing retina and threatens vision. The study's findings were published in JAMA Ophthalmology. In a small study of 6 unrelated participants, researchers linked the gene UBAP1L to different forms of retina dystrophies. The patients had symptoms of retinal dystrophy starting in early adulthood, progressing to severe vision loss by late adulthood. The patients in the study showed symptoms and features similar to other inherited retinal diseases, but the cause of their condition was unclear, said Ben Wane, PhD, Chief of the Ophthalmic Genomics Laboratory at NIH's National Eye Institute and a senior author of the report. Now that we've identified the causative gene, we can study how the gene defect causes disease and hopefully develop treatment. Rising concern: the growing epidemic of childhood overweight and obesity. Since 1990, the rise in childhood overweight and obesity has surged across every continent, almost doubling in prevalence. Globally, Asia has nearly half of all overweight children under the age of 5. The deleterious consequences of this epidemic are already evident: childhood hypertension, type 2 diabetes, among others. Researchers from Florida Atlantic University's Schmidt College of Medicine and colleagues sound the alarm and discuss both challenges and potential solutions in a commentary published in the Maternal and Child Health Journal. Pediatric overweight and obesity have reached epidemic levels in the US and are becoming a pandemic globally. These conditions lead to high blood pressure, type 2 diabetes and lipid disorders, which contribute to metabolic syndromes. In adults, these issues significantly increase the risk of heart attack, stroke, liver disease, obstructive sleep apnea, arthritis and certain cancers, many of which are now occurring at younger ages, said Charles H. Hennekens, MD, first author and the first Sir Richard Doll Professor of Medicine and Preventive Medicine, FAU Schmidt College of Medicine. Through coordinated clinical and public health efforts, we can address these troubling trends and work towards a healthier future for children and families globally. The authors report on the leading causes of this epidemic, including high body mass index, which increases the risk of many serious health issues. In the US, a preschooler is considered overweight if their BMI exceeds the 85th percentile. Research shows that these children are at a significantly higher risk of being overweight during adolescence compared to those with a BMI at the 50th percentile. This underscores the misconception that children simply outgrow overweight issues. MMR vaccine, most effective against measles but may wane over time. Lancet Public Health. Between 2011 and 2019, the proportion of measles cases in adults who received 2 doses of the MMR vaccine in England increased from 1.9% to 7.2%. However, the cause of this increase remains unclear. A new retrospective modeling study published in the Lancet Public Health Journal suggests slow MMR vaccine waning may partially contribute to rising measles cases in double vaccinated people when outbreaks occur. However, study authors emphasize that the MMR vaccine remains the most effective measure to prevent measles infection and that community vaccination levels above 95% are essential to prevent outbreaks in the first place. In 2011 in England, 20 individuals who were double vaccinated were infected with measles, compared to 989 unvaccinated people. Whereas in 2019 in England, 57 individuals vaccinated twice had measles compared to 666 unvaccinated people. More than 95% of individuals gain immunity after a single dose of MMR vaccine. This means that after 2 doses, a small proportion of vaccinated people may be infected because of a lack of immune response. Due to this, it's expected to see a small proportional of measles cases in vaccinated people. This study is the first to use mathematical modeling to suggest measles cases and spread in England are consistent with a small amount of waning of vaccine-induced immunity. Although our results suggest that a slight waning of immunity from the MMR vaccine over time explains why we are seeing an increase in the proportion of measles cases in double vaccinated people in England. It's important to know that the biggest risk factor for measles outbreak by far is low vaccination rates. The MMR vaccine remains highly effective, and receiving 2 doses will protect you and those around you against measles infection. Even if you are one of the small number of people who get an infection after 2 doses of MMR vaccine, previous studies suggest measles symptoms in people who have been vaccinated are milder than in people who have not had a vaccine, says Dr. Alexis Robert, the London School of Hygiene, Tropical Medicine. Endovascular management may improve patient outcomes in cases of acute stroke. Stroke related to large vessel occlusion is a leading cause of disability and death worldwide. Endovascular therapy has transformed the management of these patients. Evidence for the treatment benefit has also been extended to patients presenting within 24 hours of symptoms onset, along with patients with large ischemic core infarct and patients with basilar artery occlusion. However, ongoing knowledge gaps remain, including an understanding of which patients with a large ischemic infarct are more likely to benefit from endovascular therapy, the role of endovascular therapy in patients who present with low stroke severity scores on the National Institutes of Health stroke scale or have medium or distal vessel occlusion, and optimal management of patients with underlying intracranial atherosclerotic disease. In a review article in the journal Lancet, researchers from Boston University, Chobanian Avedisian School of Medicine, and international collaborators examined the rationale of recent randomized trial design and results that have proven the benefit of endovascular therapy, including reviewing current devices and addressing ongoing areas under study. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.